So, did you know that lead poisoning, taking the lives of at least over 1.5 million people, taking the lives of people that you know have died from non-communicable diseases? I bet you didn't know this. We sat and had a conversation with Pure Earth, an NGO, seeking to at least heal the earth of such poisoning. And here's what they had to say. Hello there, welcome back to the show, and thank you so much for staying with us. So let's talk about this very important or serious matter. You may have seen it, you may have heard it somewhere in the news, but you didn't know that it was this serious. Today, let's put some seriousness on it. So if you're far from your TV, come closer and let's talk about this. Lead poisoning, quite a painful one, very silent, you may have not known. But today, we get to understand what lead poisoning or lead pollution is, which is taking the lives of a little over 1.5 million people. They die. And guess what? If you combine HIV and malaria together, it's not even up to this number. This is why we must talk about this. And today, to get a bit more education and what Ghana or what persons who are interested in this matter are doing to at least curb the situation, joining me is president of the non-profit organization focused on tackling lead and mercury pollution, Pure Earth, Andrew Makata. And also here is country director of Pure Earth, Esmond Kwanzaa. Thank you, gentlemen, for joining me today.
Thank you.
Thank you.
So, I mean, I've heard in the news, especially because in Ghana, galamsey is very prevalent, and so we may have heard, but we may have not put a lot of seriousness in this. I'll start with you, Esmond. Tell us exactly what lead pollution is. Let's put some understanding to it before we get into how widespread it is.
Right. Thank you very much for having us again. And the media outlet has been a partner with Pure Earth for some time now. So lead pollution is a global issue, not affecting only Ghana. Usually, lead, it's a heavy metal, but it's also malleable. And it can be recycled. It can also be intentionally or unintentionally, added to consumer products. And when that happens, we say lead pollution has occurred. So your car battery, for example, you have 75% of your car battery is made up of lead. Now, when your car battery reaches the end of life, what happened to it?
Maybe the car won't start.
Okay, so probably you put it out there and I'll give it to your mechanic or somebody. Where does this end up to?
Oh, yeah.
Now, when this is recycled in informal way, it ends up polluting the environment. It becomes a pathway of exposure.
Okay.
Same with the consumer products we're talking about. We are not supposed to have lead does not play any role in any consumer items. So when you find lead in consumer items like medicine, like eyeliner, traditional eyeliners, like utensils, then it becomes a pathway of exposure. And when that happens, it leads to poisoning. So the numbers you are throwing out, as a result of lead pollution, you get poisoning. And then it leads to complications.
Okay, now I'm afraid because I want eyeliner today. Andrew, let me come to you. I would have thought that we should be concerned only in Ghana, but I'm just learning that it's a global issue. You want to tell me how widespread lead pollution is?
Sure, yeah. This is an issue that affects countries around the world, low and middle income countries in particular. So it's not just Ghana. Countries across Asia, Africa, and Latin America are all struggling with this issue, and awareness is very low today. Fortunately, awareness is growing quickly at this point. But for example, lead is taking 5 or 6% of global mortality. Can you imagine something with so little awareness taking such a massive health toll? Nearly 1 billion children in the world have a concentration of lead in their blood that exceeds the World Health Organization's threshold for intervention in the child's life. So it's really a massive public health issue. I
see. I mean, Esmond, I know that you've just mentioned a few of the things that could be the sources. Let's get a little bit into that. You mentioned if, for example, car battery, if recycled informally, this will mean that there's a way we can handle some of these things that will not lead to lead pollution. So let us in a bit more on that.
Yes. So usually the lead in car battery, if recycled in a formal way, according to laid down procedure, it would not lead to pollution. So what Pure Earth has been doing on the global stage and also in Ghana is working with the authorities, the government agencies. One thing about Pure Earth is that our mission is to partner the government and the community and industry leaders to find solutions to toxic heavy metal pollution like lead. So Pure Earth has been working with the agencies here to strengthen regulation to ensure that the lead use battery acids are recycled in a very safe and sustainable way that will not lead to pollution.
Okay. Andrew, but of course, I like to think that some people are more at risk, or everybody is at risk. Is that it?
No, people are more at risk than others. For example, if you live in an industrial zone where car batteries are being recycled unsafely, you'll certainly be more at risk. And actually, Pure Earth has tested the blood of thousands of Ghanaians to see the disparities and the geographical differences. And we found that kids were particularly at risk when they lived in industrial zones. But other hotspots emerged also. So kids in the northern region had high concentrations of lead in their blood, and there isn't much industry up there, not a lot of car battery recycling. So we're currently investigating what kind of consumer products might be exposing them to lead.
I mean, I know that you're a researcher, but on top of your mind, what do you think would be contributing to that?
We think that food and consumer goods are probably a significant pathway for exposure. So for example, we've tested lots of market goods, and we found lead in traditional eyeliners. Sometimes it's called kohl or kajal or chilo in Ghana. And these traditional eyeliners often contain lead.
Right. Consumables. In my little readings, I've been learning that ayelo, white clay. Is this true?
I think it's an area that we are learning more. There have been some levels of concentration of lead found in that, but it's still an area under study. A lot of detailed studies being done to ascertain the extent of heavy metal contamination in the ayelo, the one the pregnant women chew, right? Yes.
Let's talk about Pure Earth more. Particularly, what is your focus in this? Maybe Andrew.
Sure. So we focus on preventing human exposure to toxic chemicals, but right now we're really focused on two chemicals. Lead, because it is by far the chemical that takes the biggest toll on global health. But we also focus on mercury, which we know is a challenge here in Ghana as well, with the mining and the pollution of rivers and then the pollution of the food system. And we basically approach these chemicals with three types of interventions. Understand the level of exposure, typically through biomonitoring and health surveillance. Then understand how people are getting exposed. Is it in the environment? Is it consumer goods? Is it food? And then finally, work with government in all three stages to design solutions. Does this need a regulatory response? Is it community education that's needed? Do we need to work with industrial producers to change their practices? And fortunately, we're going to be working over the next 4 years in Ghana to do all three of those steps.
Okay, oh, that's good to know, refreshing to know. But Esmond, how difficult or easy has it been so far in trying to even bring up this conversation in Ghana, especially because of what you're researching into lead and mercury, which is almost a lifestyle thing for us in this country? What has been the response like so far? Easy, difficult?
Yeah, I would say it has been challenging, not easy and not difficult as well. Pure Earth has been working with the government of Ghana since 2007, right from the putting spotlight on the issues in Agbogboleshi, e-waste project, all the way down to the current projects that we are implementing. And as I mentioned earlier, Pure Earth's mandate is to work with government agencies to be able to address these issues. And so I would say that given the scale of the issue and in terms of knowledge, I mean, across the globe, little is known about this. Most people are not aware. I would say Ghanaian government has been very, very proactive in collaborating to address the issues. I remember in 2016 to 2008, we have a small project with the Ghanaian government on an action plan on health and environment pollution. And I think that action plan actually laid the way to tackle these issues head on. And then after that, we had a project, Every Child Potentials, Protecting Every Child Potential project. And that project was also very well accepted by government. And I'm happy to say that out of that project, we had develop action plan against lead poisoning in Ghana.
Okay.
And this was signed to by Ghana Health Service, Pure Earth, and UNICEF, with the blessing from both Ministry of Environment and the Ministry of Health. So this has been an excellent approach so far.
Andrew, I'll come to you. Let's stay with Esmond a little longer. Let's stay here in Ghana and let's see how you intend to decentralize this education or even trying to curb the situation. Andrew introduced us to about 3 stages of how you're going to be doing this, engaging government and all of that. Let's talk about local communities. Do you have any plan in how to deal with this at the local community level?
Great. So Pure Earth has a 5 pillars, let me say 5-pillar approach to tackling this issue. One is the health surveillance, the second is source analysis, and the third one is about designing source-specific interventions to address the issues that were revealed through the study. And then the 4th one is communication.
Okay.
So communication is very key, collaborating with the government agencies to create awareness about the meanings of this issue.
Okay.
Currently, there's a project being implemented across the industrial zones of Greater Accra, Afenya, and Pong, because our study revealed alarming records of lead poisoning in children under 5 in those communities. So we are working with Ghana Health Service, Ghana Standards Authority, and Environmental Protection Authority to provide training to environmental inspectors, provide education and awareness to community members, and we are doing this through a network of community volunteers who would be in charge of raising awareness. We are providing training to about 1,200 school children in that enclave, because we believe that when the community is aware, they can put pressure on their elected representatives to drive policy actions at the top.
Okay, that's good to know. And back to you. Let's talk about how people probably underestimate the impact of lead poisoning. Have you come across? How surprising are you? And what are you doing to at least mitigate how much people underestimate this impact?
Sure. The main challenge with lead is that it's invisible. It's invisible in a couple of ways. If it's contaminating your local soil, you can't see it. If it's in your consumer products, your medicine or your foods, you can't see it. Even once it's in your body, the impacts on the body are tough to diagnose. So it's kind of invisible in that way as well. And then all of this means that it's kind of invisible to the public in terms of awareness. So we're trying to make the invisible visible.
Right.
We're collecting data from across Ghana to make sure that everyone understands this is the severity, this is the level of lead in children, and this is the kind of health impacts that causes. It causes a permanent loss of IQ in children, permanent brain damage. It causes adults to die early from cardiovascular disease. So we're trying to make the effects visible. But also, as soon as we implement solutions, we try to highlight those so people can see this is what's being done by your government, this is how we're helping, and this is how you can protect your family and your children in your home. These are the hygiene solutions. This is what is important about combating dust coming into your home, because dust can carry lead. So it's just a big process of making the invisible visible in multiple levels, in government, in industry, civil society, and of course in communities.
Okay. I mean, finally, Esmond, I know that you launched last week. Which part of the project did you launch last week?
Yeah, so we've inaugurated a lead technical working group in Ghana.
Okay.
This is being spearheaded by EPA.
Okay.
And Pure Earth is playing a facilitation role with funding support to ensure that the issues of lead poisoning or heavy metal poisoning in general are coordinated from a central position.
Okay.
As you might know, NCDs or non-communicable diseases are among the top killers, and so there's a lot more attention going toward that direction. And if you look at that, lead it's play an important role among those kind of diseases. And so having a body at the center of this, coordinating resources, planning, programming, would ensure that the issues are addressed and tackled head on.
Andrew, finally, from tomorrow, say after this interview, anybody watching us, what are we going to be seeing? What are we going to be hearing about this?
So fortunately, we have secure funding for 4 years of a dramatic expansion of the work that we've been doing. So you will see your government taking a leadership role, the Ministry of Health, the Ministry of Environment, Ghana Standards Authority, and others, conducting health surveillance that very few middle-income countries have ever taken before, a nationally representative blood lead level survey.
Okay.
So this is rather novel in the world. You'll be seeing groups, Pure Earth and others in the government agencies, going to markets and testing everything that could be causing exposure. And then you'll be seeing policy, regulatory, environmental, and other types of intervention taking place at hotspots.
You both are amazing. Thank you for talking to us today. And we've been talking to Andrew and Esmond from Pure Earth. Thank you so much.
Thank you.
Stay with us. There's more on the show.